Hello, and welcome to YPN's Guide to Doing Med School.
Your go-to resource for thriving in osteopathic medical school.
I'm Hannah Newland. I'm a current fourth-year medical student at Kansas City University Joplin and the current chair of the YPN, or the Young Physicians Network.
My name is Caleb, a third-year osteopathic medical student at A.T. Still University in Kirksville, Missouri. In this episode, we're focusing on essential study strategies tailored for first-year osteopathic medical students.
And of course, studying is different for every student. We just wanted to cover a few pitfalls and things that have worked well for students in the past. Me specifically, I'm going to be talking about my own trials and tribulations, and also as a current OMM fellow, what has worked for me for teaching students and how I learned to study better from that. Now, with each class, you will discover that there are different strategies that work better. I felt that with our basic science courses, such as some foundations of medicine, it worked better to write out some of the pathways you find, specifically with those biochemical pathways. It's good to know those steps and those enzymes for those. Now, for your longitudinal courses, at least for us, OMM was a longitudinal course. We did that all year. It's a good idea to stay consistent and do a little bit each time. So going over that lecture or lab as soon as it comes out is a great way to keep that information fresh in your mind. With our class, we did not have to go to lectures live, but I found that if I didn't stay up to date with those lectures, it did not work well for me.
My personal advice in what I did in medical school is to go to class in person for the first 3 to 4 weeks and get an understanding of medical school and get a little more comfortable.
Now, another way to keep yourself honest and to keep yourself on track is to make a study planner. I just used a Google Sheets page and made what I call a pass tracker. We recommend 3 passes of each lecture or lab for the content, and the more often you see that information, the more likely it is to stick with you. So by doing a pass tracker, I was able to say, yes, I've read it or looked at it once. The second time, I'm taking notes more in depth. The third time, I'm doing my practice questions over this lecture and just trying to really solidify that information. Now, I will say honestly, I did not do this very well the first semester of medical school. You're just now getting into medical school. It's so difficult to know how to study, and maybe you didn't have to study as hard in undergrad. I know that was true for me. Undergrad or even your master's program might have been easier than what you expected medical school to be.
This can be frustrating.
And unfortunately, that's a really common occurrence for a lot of students. Reaching out to those that have already gone through it above you and knowing what they did can help, but know that you also will take some of those tips and adapt it to yourself. So for some people, using Anki or flashcards really helps, and others, like myself, I cannot stand flashcards. It doesn't work at all. I found that if I try to handwrite notes, I wouldn't get through all the lectures, and that's not good either, but typing didn't always work well. So writing on the notes themselves, on like printed out versions or on my iPad, as many schools give you one, is a really great way to do that. I will also say that you can't take failures as the end all to everything.
Sometimes in medical school, you may have to sacrifice an A to get a B or C in another class, and that's okay.
I honestly failed neuroendocrine. I thought that the pathways of the brain were so difficult the first time through, and our school, we were able to retake it. Thank goodness for that, because it wasn't the end of the world. I was just able to, take the next classes and everything, and then in the summer retake a test that combined all of the information from those 3 exams we had during that course. So specifically for that course, I would say that repetition really helped it sink in. And I actually did really well on the neuroendocrine part of my boards afterwards.
As a first-year medical student, try not to concern yourself with board examinations. Your main goal is to find what works for you as far as studying habits and passing the first year. Studying for your medical school exams is also studying for board examinations, in a way, because it covers the same information and helps build your academic stamina.
Another tip I would give for students is don't punt lectures. I know sometimes it's really hard to even get through a lecture and you're like, well, I'll just get enough to pass. At least for us, we were pass fail. And so sometimes you're like, I can only study enough to pass, which is fine at the time. But then whenever you need to know the information more in depth, such as for boards or for exams or for later on in clinicals, it's really not a great idea and you don't always stay with it. And by not looking at that information the first time you saw it, when you had time dedicated to learning it, you'll find that it's way harder to try to relearn in a crunch time when you're trying to study everything, such as for finals. So getting that information in the first time you see it, even if it's just one watch through or two, it will really help you when it comes to the future.
Watching the recorded lectures online definitely has its perks. One is that it's faster. You can put it on 2 times speed and get done in half the time. You can also pause and rewind the lecture if you didn't hear the lecture or you needed to go back and write something down you previously missed. Some downfalls of watching classes online can also be dependent on the school. If the recording is only a screen recording of the lecture slides, you will not be able to see the laser pointer or the lecturer.
Now, specifically for osteopathic manipulative medicine and for studying for that, like I said, those lectures might come out, and if you're not required to go, you might not want to. I actually found that the way our school did it was that it helped enhance our learning of our core classes. So whenever you're learning about anatomy, if you can compare it with counter strain and how those muscles shorten to treat in counter strain, that can really help you both with your anatomy knowledge and your OMT and OMM knowledge. The more you know about anatomy, the better you can be at treating an OMM. That's actually what AT Still founded OMM with, is a lot of knowing and knowledge of anatomy. So the better you know that anatomy and those muscles and how they work, the better you can treat your patients. Specifically, like I said, with counter strain, but also muscle energy. If you know that counteraction to the muscle, you're able to shorten it and cause that release of tension in that muscle so that that patient has that relaxation. With BLT, similarly, we're going in the direction of a dysfunction. And so if you know the normal anatomy, you are able to use and apply these techniques, not just to, the back. And I know I have to go against with the thoracic vertebra, so I'm setting them up opposite for muscle energy. But if you know that basic, you can use it on your wrist and your arms and everywhere else. And it's just a great way to integrate OMM with your core classes as well, not just the longitudinal ones.
The best way to study this is hands-on practice. Try dedicating time to practice OMM techniques in lab sessions and with your peers or even on your family.
If you have someone in your class who's really great at it, learn from them. Teach back method is such a great way to learn, not just for OMM, but all of your classes. If you're able to really get a subject and your friend is struggling or a classmate is struggling, reaching out and helping them and then helping you on something else is a great way to learn.
If you are able to teach or talk through the material to someone, then you know the material very well.
I actually would write practice questions because that was a great way that I could learn from it. And knowing and thinking about what is a professor going to ask on this test is a great way to then not only help others by looking at these practice questions, but also really gauge how well you know the information. If you can come up with an explanation of why that's the correct answer, you know that content so well. And I really recommend that. Similarly with that teach back, teaching each other different techniques is a great way to study for your practical exams. If you see that, you have BLT, muscle energy, and counter strain on an exam, and they tell you the different body regions for that practical, making little slips of paper and just drawing it out and being like, this is the one we're doing. And then doing that and having someone else grade you off your own rubric is so good for studying for those practicals. It's a great way to know where you are and how ready you are for that exam. Similarly with practicals, with anatomy practicals, going in and testing each other on body parts is a great way to know where you stand for that exam.
It is important, though, that everybody in the group has gone over the material to some extent in order to have a productive discussion.
In undergrad, I did a human dissection course before we did in medical school. And so going through and knowing those different layers and the muscles and nerves and arteries and veins, and being able to show my friend, oh, I did this section of the body, so I know this one. You did this section, so look, we can teach each other. But also going in and just pointing out a structure. What is this? What is this? What is this? Or going through your structure list and being able to point out where everyone is, where each structure is going to help you immensely. Now, I know some schools have you write out the answer. You have to spell out everything correctly. So knowing the spelling of structures really can help too. Some are a little bit more lenient. Some will have you do a multiple choice, but making sure that you truly know the information is the best way.
Using 3D anatomy apps and cadaver labs to visualize and understand spatial relationships between structures is imperative for anatomy. Recommended resources include Complete Anatomy App, Netter's Atlas of Human Anatomy, and Anatomy Zone.
So it might sound like I'm saying you have to spend all your time studying, and sometimes it feels like that. But also knowing when to take a break and scheduling the breaks in can help immensely.
Tools you can use to manage your time include the Calendar app, Trello, and CramFighter.
So for me, I'm a single mother. I went through medical school entirely with just my daughter and me. Now, I did have help from family occasionally, but for Monday through Friday, most of the time I had her. And so I made sure that my studying was done while she was at school. So 8 to 5, because she went to an after school program, I was studying. That was my dedicated study time.
Some good advice I got in medical school was treat medical school like a full-time job.
Because it someday will be a job.
This means getting into a routine of when you start studying in the morning and a relative stop time in the evening.
Now, there are some people who can wake up at 4 a.m. and study till noon, and then they're done. They go and exercise and do everything else, and that's fine. There's some people who don't get up till noon, and they stay up till 10, and that's when they get their studying time. Whatever works for you with that schedule is totally fine. But just know that I wasn't studying completely from 8 to 5. I was studying from 8 to 11. I would take lunch. I would take a break, take a walk, start again like 1 to 5-ish, and then go pick her up and then make dinner and spend time with my daughter, because family and our relationships and our friendships are just as important as studying.
A more in-depth discussion on balancing study and other responsibilities will be in a later episode.
I also know students who did not want to study on the weekends. That was not what they wanted to do. So they made sure with their Past Tracker and other study planners that they got their time in before the weekends. So you need to make sure you are scheduling your study time appropriately for your life. There will be people who say, I wake up at 8, I don't go to bed till 10, I'm studying from that time till then. They are only studying. They're like, I study while I eat, I study in my sleep, But actually, that's not always best for you. Making sure you're getting enough sleep, that actually helps your memory. It helps lock in that information you studied. So being very consistent with your study schedule and being consistent with the repetition of your studying.
The resources I used during first and second year were the professor's notes first. I would then use sketchy videos to cover microbiology, Ninja Nerd on some complex concepts, Pathoma, and USMLE First Aid for some general concepts when needed. Remember that you can always ask the professor who's teaching the class to help explain a topic for you as well.
Now, of course, there will be lectures that come out closer to the exam, and you're going to feel like you can't get in enough passes for that. But getting in as many as you can and getting that information in before the exam is going to help you more than anything. But also, don't forget the beginning. So as you have lectures that are maybe 3 weeks before the exam and you get closer and you're like, well, I've already done that 4 times. I don't want to look at it again. Maybe do some practice questions or flashcards, different things like that just help you pull that information forward.
I recommend picking 2 to 3 resources to use. Remember, having too many resources isn't always a good thing.
I think practice questions have been one of the best ways to study, because you are actively trying to recall that information and take it into a practical environment. But also trying to recreate your testing environment is going to be really beneficial to you if you're able to study like in a lecture hall where you take the exam. That can help. Studying in a quiet room. Some people like studying in libraries. Some people are fine if there's background noise. Just finding what works for you. That's really the best advice I can give, is what works for you. Everyone is different. You're going to hear so many stories. At the end of the day, it's what works for you. And also, one of the best pieces of advice I can give is do not compare yourself to your classmates. Some of your classmates will get the information and they only have to study the week before the exam. They don't do anything beforehand, and that's great for them. But I know for me and for many others, we have to do it from day one, and that's all we're doing. But again, prioritizing different lectures, what you're not as good in. If you're not as good in histology, spend a little bit more time with that. If the anatomy comes intuitively to you, help others with it.
I found one of the most difficult aspects of medical school was the amount of information thrown at me all at once. It is also important to not forget about the classes you don't enjoy or aren't the best at.
Personally, I really struggled with sacral OMM, and I say that as someone who has chosen to be an OMM fellow. But going through this year of an OMM fellow and teaching my students sacrum, it finally clicked for me. I finally understand the sacrum. I think I could teach a whole lecture series on sacrum. It's like I finally get it. But it took me 3 years of medical school to do that. I had my first year of actually learning it. My second year, we reviewed it. I did boards over it. I did my third year rotations, and again, had to take boards again and reteach myself the sacrum. And finally, as a fellow, I was like, oh my goodness, it clicked. It's the axes. That's where it makes sense. But I digress. I really think if you are good at something, help others, and then you will grow in it and get better. So while I was always, the bone wizard, the OMM girl, I helped my friends with that. Well, they were really good at physiology, and I was struggling in some aspects, and they were like, hey, let's talk about it. Let's sit through, let's draw these pathways.
In physiology, mastering key concepts is very important. Focus on understanding the mechanisms and processes rather than memorization. Equations are a big portion of physiology, but I was rarely required to calculate using the equation on a test.
Embryology was the bane of my existence. So my friend who is going into child neurology would help me with it. And I just think sitting with those groups, talking through everything, we had learning objectives that would kind of direct where our studying needs to go. And that was so helpful. If your school doesn't have something like that, reach out to past students, like the ones in the years above you, and see where the professors kind of directed their learning.
The best resource to use in medical school is your professor's notes and lectures. Most of the test questions are pulled from these lectures, so it's important to know these.
That will really help. Like, we actually had our professors tell us, and I always say take that with a grain of salt, because sometimes they don't mean to trick you. They think that's what they're testing over, but then they test over something else. So, the students can tell it more like it is than the professors. Our school also had resources such as learning enhancement or counseling. Those people can really help you. Making sure your mental health is in line can really help. It's really hard to study and to focus on school when so much outside information is coming at you as well. So if you're struggling with life things, it's okay to ask for help. Like I said, I had failed neuroendocrine, but when I look back on it, my daughter had some health problems we had to go through. I was going through a transition in a relationship that I wasn't happy with, and I was really depressed. I was in the height of COVID, and I didn't know where to turn to. I couldn't see my friends. Everyone was so busy with studying, and we had to stay inside, and because of this global pandemic, and I felt like I was the only one struggling with it. Now, as we transitioned into the summer and I got more focused on other classes and we were able to, open up things a little bit more, I found out, no, a lot of people had struggled with neuroendocrine, and I was able to have a study partner for it, and that really helped. So being able to fall back on your friends and help is just so imperative.
I hope you found these study strategies helpful and feel more prepared to tackle your first year of osteopathic medical school.
And just knowing that we can all do it, and we've all been through it, we've all struggled, And even if things don't go your way and you fail, you can still get back up. If you fall down 7 times, get back up 8.
What do they call the medical student who graduates with all C's? Doctor.
The Young Physicians Network, or YPN, is a new initiative of the Missouri Association of Osteopathic Physicians and Surgeons. If you're interested in getting involved or supporting osteopathy in the Show Me State, visit MAOPS, that's MAOPS.org.